My name is Shante. I'm going to be your nurse today for the next 12 hours. Before I get started, I'm going to be doing an assessment on you, a head-to-toe assessment. Have you ever had one of those before? Yep, exactly. I'm basically going to be checking out all of your different systems, your head, your brain, your heart, your lungs, your breathing. But before I get started on this, it is going to take us a little bit of time. Do you need to use the restroom? No, you do not? Okay, great. All right, so let me just wash my hands really quickly and I'll come on back. Okay, so the first thing that I'm going to do is I'm going to check out your brain, we'll put it that way. I'm going to ask you 4 silly questions, okay? State your first and last name for me.
Tracy Jones.
Tracy Jones. And where are you right now, Miss Jones?
Halifax Hospital.
And tell me what brings you here.
My throat hurt.
Okay. And please state today's date.
February 19, 2020.
Okay, so the client is alert and oriented times 4. The next thing I'm going to do is I'm going to shine a little light in your eye, but before I do that, I'm going to go ahead and dim the lights. Okay, so I would need to dim the lights. And I'm just going to go ahead and shine this light in your eye here a little bit, okay? But I need you to do me a favor and look straight ahead. You know the pupil size. It's dark in this room. Okay. I noticed that was 4 in brisk reaction. Thing. And I noticed that when I shine a light in this eye, actually this pupil size is 4 and this one is 5. Perla is not intact. Okay, so the next thing I need for you to do is I need for you to stare at the tip of my pen, okay? That's the first thing that I'm gonna have you do. And then I'm gonna have you look straight at the ceiling tile, okay? And then look back at the tip of my pen. All right, I notice that the eyes do accommodate. Next thing I need for you to do is stare at the tip of my pen, keep your eye on the tip of my pen, and as I move it, I want you to follow the pen without moving your head, okay? Great. I'm just basically checking the muscles in your eyes. Great. Just a couple more. Okay. Extraocular movements intact. All right, so I don't need this anymore, right? Right? Okay. So the next thing I'm gonna do, I'm gonna cross my arms and I'm gonna have you, no, you don't cross your arms, you keep yours straight, but I'm gonna have you give me a good squeeze as hard as you can. I can take it, go ahead. Great, I know that the strength's equal, symmetrical. It is, I give it about a 3+, pretty strong. Okay, I'm gonna test for the same thing. I'm just checking your strengths in your arms and your legs. So what I'm gonna do is I'm gonna press down on your feet, and as I press down, I need you to lift up against that, okay? Against, my hands, okay? All right, great. I give 3+ as well for both. Okay. All right, so that is neuro. I'm stopping to check to see if there's anything else that I've missed within my box. I've asked my 4 questions. I have checked for Perla. In this case, and I went with what I really did actually see, the pupils were not equal, okay? And in that case, what would I need to do? I'd need to check and see if that's normal for the client. I'd need to also check their initial baseline assessment, and then I'd need to follow up on that. I also checked extraocular movements, that's intact. I checked upper and lower extremity grips. Those are all the different things that are included in neuro, in the N box. Respiratory, all right, so the next thing I'm gonna do, I'm just gonna take a listen to your lung sounds, all right? And then first I'm gonna start in the front and then I'm gonna go ahead and turn you over. That will be the only time I'll need to turn you during this assessment, okay? All right. Before I start though, have you noticed that you're having any shortness of breath? Are you finding that you're having any difficulty breathing? No, and I'm also paying attention for signs of respiratory distress, which clearly I don't see any. Also, I'm checking out the skin in the chest area. All right, I didn't mention it, but I also, when I did neuro, I was checking the skin in the head and neck as well. Listening to the first. Okay. And if I don't hear the airflow like I need to, I am going to go ahead and have them take a deep breath. Good. Five. All right, I'm gonna have you take a deep breath for me again. Deep breath. Good. Deep breath. Okay. I noticed that the bases are diminished. That's why I asked for a deep breath. Okay. All right, now I'm gonna pull your gown down just a little bit here, your blanket, and I'm gonna have you reach for that arm rail over there. Good. Bend this knee. Yeah. And we're gonna have you turn to the side. Great. I'm gonna expose you a little bit back here because I do need to check out your skin in addition to listening to your lung sounds back here. All right, I wouldn't do this in the real world, guys, but I'm just gonna rest them there like that. Two, three, four, five. Go ahead and take another deep breath for me. And again. Okay. So I've diminished lung sounds in the bases anterior and posteriorly. Clear lung sounds throughout. Okay. This time I'm just gonna go ahead and check your skin, okay? I do notice that we have some abrasions here, probably from my night PN students. Scratching out my client when they transfer them to the chair. I notice that there's no other skin breakdown. She has a stat lock still in place. I'm not really sure why, if there's no Foley, so I'm gonna need to work on that, checking the skin back here. I'm also gonna check the skin on the back of the heels because that's a common place for skin breakdown to occur, and I don't see anything. Okay, I'm gonna go ahead and bring you back, okay? Great, thank you. Cover you up here, sorry. In addition to checking out the skin and doing a preliminary GI assessment on the posterior aspect, I was also checking out the skin on the upper aspect of the back where I was listening for the lung sounds, which that's my integumentary for respiratory. So knee, look, listen, feel. I'm gonna go ahead and check capillary refill here because if not, there's no feel for respiratory. All right, I'm just gonna go ahead and press on the tip of your finger here. All right, less than 3 seconds. And I notice the same. Now the reason why I chose to tap the tip of the finger or press the tip of the finger is because this client has on nail polish. So you're not gonna see the capillary refill return time with that, but you can press on the very tip of the finger. Capillary is a capillary, okay? All right, so that's respiratory. All right, so I'm gonna listen again. This time I'm listening just for your heart, okay? This time you can breathe normally, okay? So I'm gonna find my sternum, second intercostal space, my clavicle, second intercostal space, right of the sternum. It's my aortic. I'm gonna go right across the sternum to the left, pulmonic. And I'm gonna come down to the third, and that's Erb's point. And then I'm gonna come down to the fourth. That's where I'm gonna hear tricuspid. And then I'm gonna come to the fifth, but now flip over to mid-clavicular line, which will also be, should align up with the areola of the nipple there. right, that's mitral. And I'm gonna listen and stay here for 1 full minute, which is also my apical pulse and point of maximum impulse. Okay. Now, in the tricuspid and mitral, I should hear lub or S1, and in the aortic and pulmonic, I should have heard S2, which was dub. I shouldn't hear anything extra. Okay, lub and dub. Okay. All right. So I'm gonna go ahead and place that down because now I don't have anything else that I need to listen to, and that's something that you can use as a check to get the things out of the way when you're done with them. Okay, that's what you want to do. Got it? All right, so the next thing that I'm going to do is quick question. Have you had any chest pain or anything that you've noticed? No chest pain at all? Okay, great. All right, so the next thing I'm going to do is go ahead and palpate my pulses. I'm going to do carotid, brachial. I'm going to defer the femoral. Okay. Radial. My landmarks. Okay. And what I'm finding is that the strength is 2+, that's a normal strength. Okay. I'll find my landmarks here. I'll try not to stand in front of you all. Okay. 2+ throughout. These pulses are going to take a little bit longer to find. 2+. Okay. And then my popliteal. Got them. Okay. Additionally, while I'm down here, I'm going to check for symmetry here. I noticed that this leg is, it's warm, it's dry. This one is swollen. It's almost, it's definitely larger than this one, and it's reddened. Okay. Hot. This one is not. So this is not symmetrical. And it would make sense why there's TED hose on one and not the other, because this one probably, it's very possible that this one may have a DVT. Okay. So I'm going to make sure that I report that, I document that, I report it, because if they do, I definitely don't want to ambulate them, because if they have a DVT, I could dislodge that. All right, so cardiac, I already did cap refill within respiratory. I asked my question while, of course, I was looking. Now, stethoscope needs to go, of course, underneath the gown. You guys know that. On both respiratory as well as cardiac. We got it. And I looked, I listened, I felt, I asked my question. Nothing else that I need within cardiac. All right, so GI. Oh, there is one more thing I have to listen to. Okay. GI. I'm just going to go ahead and take a listen to your stomach now, okay? Before I get started on this, and I'm almost done. Actually, the hardest part's already done. When's the last time that you had a bowel movement? 3 days ago. Okay, now is that normal for you?
Yeah.
Okay, all right. So was that a normal bowel movement as well? Was it, was it the same color that it normally is? No, it was a different color. It was actually brown with red streaks in it. Okay, all right. So, and did you have difficulty passing that bowel, having that bowel movement? Yeah, I did.
Yes.
All right, so that's something that we're going to definitely follow up on, but I'm going to go ahead and take a listen, okay? Looking at the stomach. Before I listen, I'm going to see, I'm checking for symmetry of the abdomen. I'm looking for any scars, incisional, because perhaps there's something that happened with the patient that's not in the chart. Oftentimes it happens just from your thorough assessment. I noticed that you have a lower abdominal incision here, as well as 3 laparoscopic. Did you have, you had your gallbladder removed? Oh, and you've had 2 C-sections. We don't have any of that in the chart. Okay, thank you. I'm just going to take a listen. 1 full minute, right lower quadrant. 1 full minute, right upper. 1 full minute, left upper. And the reason why I'm doing 1 full minute is because while I was listening, I heard about 7 sounds, 7 to 10 in each. Okay.
Mm.
Oh, this one I only hear 4.
Mm-hmm.
Okay.
That's like, wow.
So I'm gonna listen for 5 minutes here now. Okay. During that time, I'm gonna do some other things. I'm gonna multitask. I'm not gonna talk to my client per se because if I'm talking to them, I can't hear what I need to hear. Okay.
Mhm.
And that's that for that. During that time, I still only heard an additional 7 sounds in 5 minutes. So we have an issue,
Mm-hmm.
right? Okay.
Yes.
All right, so look, listen, feel. I asked my question. So the next thing I'm gonna do is I'm gonna lightly palpate your stomach or touch on your stomach here, okay? So I want you to let me know if you feel any pain or tenderness. No, none up here. None down there. No, okay, all right. And I'm not gonna percuss because I already did that on my initial assessment. And I don't need to do that right now. Okay, alrighty. GI, GU. So I'm gonna ask you a question here. I noticed that, did you have a Foley removed recently? Oh, somebody 3 days ago?
Yep.
And you're wondering about the, yeah, we'll go ahead and get this sticker off. I'm not really sure why it's still there, but it's, maybe it was overlooked, but we'll make sure we get that taken care of. And no, I don't need to send the tech in, I can do it. No, the tech has other things that they can do. It's the kind of nurse you're gonna be, okay? So, but I am paying attention to the skin. I've noticed that this has been here for 3 days. Is that a problem? Yes, it is. We'll take it off. I'm sure they have it here for a reason. Okay, alrighty. No Foley. So with when they took the Foley out, that was about 3 days ago. Since then, have you had any burning, any difficulty voiding on your own, urinating? No. And the last time that you urinated, have you noticed that it's anything different about the color or the odor? No, same color and odor. Okay. Alrighty. GU. So I'm good with that part. Musculoskeletal. Okay. So here's what I'm gonna have you do for me. Can you raise your arms up on your own? Great. As far back as you can go. Awesome. They're doing this on their own. And come out. Great. Flex your elbow like you're making a bicep there. Great. Any discomfort with this? No. We're going to do the exact same thing on the opposite side.
That's a strong one.
Oh, yeah. Up. Yeah. Awesome. Great. Any discomfort with that? No. Okie dokie. Okay, we're gonna do the same thing in your lower extremities. Okay, I'm gonna bend your knee, or I'm gonna have you bend your knee. Up. Great. And how far can you go? Oh, you sure are flexible, aren't you? Great. Oh, yep. Awesome. And then the same one on the other side, the same thing.
In the face.
Look at that. Oh, this one's, oh. Okay, let me come back to this one. Are we able to do the same over here?
No.
No, that's your, okay, so I noticed that I have decreased range of motion in the right lower extremity. Now, the thing with this one, I forgot that I pretended that this had DVT, so let's scratch that. All right, so we've got a possible DVT on this one, okay? I forgot that I made that my scenario, and I'm gonna use that little red thing to indicate that. So with this, I'm gonna move this very little. Understood? I really don't want to elevate because if I elevate a DVT, what's going to happen?
It's gonna,
Correct. So until I know for a fact.
Well, there went the video.
What? Say what? Okay. It's important because I would have just messed up. So y'all are killing me. Is it my video or is it your video?
it's
Well,
your
it's your
video.
video now.
Thank you. All right. So
That's the
if you
DVT
had a DVT leg, you wouldn't be doing all of this. If you go and you do all this, what would you just have done? Dislodged your clot. Okay, very good. Okay, so NiRiCiGiGiMi integumentary final sweep. This client does not have any lines, so there's nothing else. The only other thing that I noted again was just that mild abrasion on the posterior aspect, and that's all that I have for skin. Okay? Any questions, comments, concerns?